Begin.
Okay, so my name's Danon Ray, and we'll be doing our presentation on the accreditation of healthcare organizations. And so the first question is, what exactly is accreditation? And so I guess the exact definition of accreditation or to like accreditate something is the action or process to officially recognize someone or something as having a particular status or being qualified to perform a particular activity. And so, I guess more related to healthcare, the ACHC, which is the Accreditation Commission of Healthcare, which is a major accreditation um, organization that accredits hospitals. Their definition of accreditation is a process. One second. Uh, Accreditation is a process of review that healthcare organizations participate in to demonstrate the ability to meet and predetermined criteria and standards of accreditation established by a professional accrediting agency. Accreditation represents agencies as credible and reputable organizations dedicated to ongoing and continuous compliance with the highest standards of quality. ACHC collaborates with industry experts to create standards to ensure the quality to maintain throughout all aspects of the organization. So pretty much accreditation is, in this case, a hospital or a health organization going to this agency and getting kind of, I guess, reviewed, and then when passed, they get this accreditation, which is pretty much saying that they meet a specific standard of quality that certain agency deems to be accreditable. And so, what is accreditation continuation? There is many different organizations that can earn this accreditation. Different accreditations. It's not just hospitals alone, but it can be doctor's office, nursing homes, surgery centers, behavioral health treatment facilities, and also providers of home care. And so there's a wide array of organizations that can be accredited. And so the next question would be why would a healthcare organization want to get accredited? And so there's a couple that I found that I thought were important, and that was during the accreditation process, you can use this reviewing that they do as a tool to measure kind of the quality of the organization in itself. It also gives the organization opportunities to find some strengths and some weaknesses that they personally might feel they have for their company, or that they I guess realize during this process. It gives management, the administration side, the necessary information to make more key decisions to how they want their organization ran, so they can adjust according to what they see and what they feel each during the accreditation process. It helps strengthen the day-to-day operation, so it allows um, individuals to look and to see where maybe they can add more to the operations, or where maybe they can, um, I guess, hand off different duties to different sections. It gives employees a clear understanding of their individual roles. So kind of the previous thing of it allows employees to look at their individual duties uh, and to I guess determine whether or not they need to change what they're doing. It allows also the credibility and commitment for their patients. So it allows their patients to see um, that they are taking extra steps to make sure that they are giving the patient the best care they possibly can. And so then that kind of brings us
Um,
up.
kind of brings us to voluntary or mandatory. I'm Tanner Holyoke. I'm the other partner in this presentation. When talking about accreditation, it is a voluntary process. The hospitals and other healthcare facilities can choose if they want to become accredited or not. It is not required by federal or any state laws. But it is a good idea because of the reasons that we just saw, that it does put the gold stamp of approval on a healthcare facility to show that they are meeting certain standards and they can receive feedback of how they're doing and things like that. So it is a voluntary process. And speaking of the process to become accredited basically is a three-step process. First, you got a preparation stage where you submit an application, you submit payment, and other things that an organization who does the accrediting needs. And that takes approximately 4 to 6 months to complete. And then once that preparation is done and everything is submitted, there is an on-site survey scheduled and performed where certain people from the organization come out to the facility and they look around this facility, talk with the physicians, talk with other medical staff, see kind of what they're doing, ask them questions like that. And then the results are given, not at that time, the results are usually given at a later date, regards to if they passed and if they got the opportunity to be accredited or not. And this accreditation takes quite a long time, and it only lasts for about 3 years. So every 3 years, the organization, the hospital or the healthcare facility needs to renew their accreditation. A lot of similarities between board certification and accreditation. I know that as I was studying this, I kind of got confused on the two, so it was good to clear this up. First of all, what is the same about them is they are both a voluntary process. They both document the highest level of care, and it's kind of like the stamp of approval, like I said. And both processes include a series of tests. However, the main difference with the board certification is that it is for individuals. Physicians, they're the ones that usually get board certified, and they do it usually right after medical school, whereas a hospital can wait a couple years to several years in operation without actually getting accredited. Usually physicians get board certified directly after medical school. The tests are usually peer evaluated. Other physicians and other people who have studied that same thing kind of give the exam or the survey. And these certifications for physicians last on average for about 7 years. Some last a little bit less, but some last a little bit more. So those are the two main differences between a certification and an accreditation for a healthcare facility. Another part of the accreditation is this thing called ISO, which stands for the International Organization of Standardization. And ISO is a group that doesn't only set standards for the medical field and the medical industry. They set standards for all types of businesses throughout the world. So as you can read there, it says that through its members, it brings together experts to share knowledge and develop voluntary consensus-based market-relevant international standards that support innovation and provide solutions to global challenges. So this organization is really there to set some standards and to decide which standards need to be best fit for which organization, and they are also an accreditation. They also accredit healthcare organizations as well as businesses. So to learn a little bit more about that, let's turn it back to Dan, and he's going to explain a little bit more about the ISO 9000.
Yes, the certification that Madison, that that Madison Medical Center uses here in Rexburg, and um, so there's this range of ISO 9000s. There's different I guess different stages of it, and so I didn't get to direct talkly to a administrative person from the hospital, but I did find while looking for contact information of who I could talk to um, this quote, this I guess statement that they have on the blog, the Pulse, and it says, "Some people have asked us why we opted out of being accredited because ISO is not an accreditation. more of a certification. Says or accredited by the DMV versus another accreditation body like the Joint Commission. There are 4 accreditation bodies that have been approved by Medicare to survey hospitals, so why not the DMV? It comes down to philosophy. In May 2001, we became the 13th hospital in the United States to become certified in the ISO 9001 2008 standards, and the DMV has built their surveying process off of the ISO standards. ISO is not an accreditation; it is a certification. And so this is kind of the big point of why they use it. It's ISO is all about continual improvement, and that is what we want our accreditation body helping us to do. We recognize accreditation as a team effort and welcome the surveyors to help us identify noteworthy efforts, areas for improvements, and even correction actions. Evaluating each of these will advance our organization from a good to great. And so something else that I also found in this blog was he talked something about how Madison Memorial Hospital kind of has this program of accredited continual medical education. So this is kind of a step to make sure that they are fit to have the certification or accreditation. And they explain that it is the CME program, which is continual medical education, brings monthly, sometimes more, hour-long presentations that are available for anyone to attend and learn more about diseases, processes, and treatment options. The material is formatted for physician learning. However, many of the health professions find these presentations hugely beneficial. And then it talks about physicians are required to obtain at least 40 continual medical education hours a year to keep their license. Madison strives to find the most relative topics that will benefit our physicians. And so, what I've learned from kind of this ISO thing is that there's different kinds of I guess accreditation or certifications that can be kind of adjusted to what you feel your hospital needs and what the administrators feel it needs. But that's our program along with our references.
That's